Good evening, students. So in this video we are going to discuss the conditions affecting GFR, right? Conditions means all the extrinsic conditions which can affect your GFR, right? So step by step we will discuss all the conditions and the mechanism behind those conditions, how exactly they affect the GFR, right? So let's start with a circle in the center. Conditions affecting GFR. Right? Now, first condition which we're going to discuss is exercise. Now, this is often when in Viva I ask from students how exactly exercise affects GFR. Many students say that exercise is going to increase your GFR, right? And it sounds quite intuitive, right? That if in exercise, if the whole circulatory activity is increasing, then it should actually increase your GFR. But this is not exactly what happens. During exercise, right, your sympathetic system gets stimulated, right? So this sympathetic system has got direct innervation in your renal artery, right? So renal artery is directly innervated by the sympathetic system. So any activation of sympathetic system is going to constrict the renal artery. So in exercise, due to stimulation of the sympathetic system, the GFR actually reduces, right? So what will happen in exercise, right? In exercise, your sympathetic system will get stimulated, right? And this will reduce your GFR. Right? Now, what are the other conditions which can affect your GFR? Right? Other conditions which can affect your GFR, let's discuss one more condition. This is pregnancy, right? Now, how pregnancy can affect the GFR? Now, as per pregnancy is concerned, the volume overload happens in pregnancy because of this hormone progesterone. It can stimulate your renin-angiotensin system, which is going to increase the level of angiotensin 2, right, which is going to stimulate your adrenal cortex, which will increase the level of aldosterone, and which will lead to sodium and water retention. So one thing is volume overload in pregnancy because of the stimulation of RAS by progesterone. Other thing is that progesterone is a potent vasodilator. It can dilate your renal artery, right? So the renal artery will get dilated and blood volume will also increase. Both these things will lead to increase of GFR, right? So in pregnancy, what are two things that is going to happen? One thing is your volume overload. Plasma volume will increase. Other thing is vasodilation because of progesterone, right? This hormone, progesterone, will cause vasodilation. And this vasodilation will increase your GFR. And progesterone, by stimulating RAS, renin-angiotensin system, will cause volume overload. And this volume overload will also increase the GFR, right? So exercise, pregnancy. Apart from that, what else can affect GFR? Weather, right? Let's discuss weather. As is common observation, during rainy season, we urinate a lot more, right? So GFR increases in rainy season. In dry season, the body try to preserve water, right? So GFR reduces in dry seasons, right? Many students ask from me why exactly we urinate a lot more during cold season. During cold weather, why we urinate a lot more, right? It is not exactly related to GFR, right? It is something related to what we call cold induced diuresis. Now this is also a very interesting mechanism, how exactly cold induced diuresis works, right? Suppose it's very cold outside, right? And now body will try to preserve its warmth inside, right? Now body will try to preserve the heat, right? Now what it will do, that blood is also a very good source of warmth to our internal organs. Now body has got a very intelligent mechanism. Body knows which organs are actually vital organs of the body, right? Body has got a very intelligent mechanism to redistribute the blood in such a way that all these vital organs stay preserved. Vital organs means your brain, your heart, right, your liver. All these are very vital organs for the body, right? So body will direct all the blood from the periphery to these vital organs. And what it will do, it will constrict all the peripheral vessels in your leg, in your hands, and direct all that blood to your brain, heart, and liver, right? This is also a very common observation that during cold season, your hands and your feet are very cold compared to the rest of the body. This is the exact reason that there is intense vasoconstriction in your periphery to redirect that warm blood into your critical visceral organs. Now, suppose this extra blood reaches these visceral organs, be it brain, be it heart, be it liver. What these organs are going to think? What these organs will feel? These organs will feel that now body has got excess blood. Now, since if the brain gets excess blood, right, now you will have less amount of ADH coming from pituitary, right? If less amount of ADH comes from pituitary, this means what? Less reabsorption of water from the kidney. If less reabsorption of water from the kidney, you will have lot of urine flowing outside, right? So cold induced diuresis is because of the rechanneling of the blood to all the vital organs, due to which visceral organs consider that the overall blood volume has increased, reduced level of ADH, less reabsorption of water from the kidneys, and more amount of urine, right? So weather, right? How weather affects the GFR. This was little off topic, but it was an interesting concept, right? So weather in rainy season, you will have higher GFR, right? GFR will be more, and in dry season, GFR will be less. Okay. Apart from weather, what else can affect the GFR? Other thing which can affect the GFR is your posture. Now, suppose I am standing, right? If I am standing, all the blood is going downwards. It's getting pooled in my legs, right? If the blood gets pooled in the veins of my leg due to prolonged standing, right, the effective circulating volume is going to reduce. Because of the pooling of blood in my lower limbs, the effective circulating volume is going to reduce. Now kidney will also get less blood because of reduction in effective circulating blood volume. So of course, because of the pooling of the blood in lower limbs, reduction in the effective circulating blood volume, GFR will reduce, right? Posture in case of standing, right? standing because of the pooling of blood. Pooling of blood. What will reduce? Effective circulating volume will reduce. Let's write in short form, ECV will reduce. If ECV reduces, the GFR will reduce. Right? What other thing the posture can do? Posture can actually stimulate the sympathetic system. If posture stimulates the sympathetic system, right? Sympathetic system, it can also reduce your GFR. So posture reduces GFR by two methods. One thing is pooling of blood in the lower limbs, reduction of effective circulating blood volume. Other thing is it stimulates the sympathetic system, which leads to vasoconstriction, which can reduce your GFR, right? What else? What else can affect your GFR, right? Other thing is sleep, right? Sleep. Now, how sleep can affect the GFR, right? Sleep has got two opposing effects, right? Let's understand those two opposing effects. Suppose I'm lying down while sleeping. If I'm lying down, now the blood is not pooling in my legs. Now more blood can reach the kidneys. If more blood can reach the kidneys, that means GFR should increase. Yeah, this factor is increasing my GFR. But in sleep, overall circulation has reduced. Overall circulatory activity has reduced. So, which is going to reduce GFR. So, two opposing effects are there. It's very easy now for kidney to get blood, but also the overall circulating activity has reduced. So, these two factors balance each other out, and there's not much change in case of sleep, right? What is one effect? One effect is now more blood can reach GFR, right? More blood can reach your renal arteries, right? And this thing will increase the GFR. Other thing is circulatory activity has reduced. Okay, because of reduction of circulatory activity, this will reduce your GFR. Right? If both these factors are going to balance each other out, right? And not much change in GFR in sleep. Because of the balancing out of these two factors, right? So this is understood how in sleep these two factors balance each other out, and there is not much effect in GFR, not much change in GFR. Apart from that, what else can affect GFR? Gender, right? Now, how gender affects GFR? Right, in females, the size of the kidney is smaller, the number of nephrons is less, so the effective filtration surface area is less, so the GFR is less. So GFR is less in females, right? In females, the GFR is less. Now, how exactly age affects GFR, right? Right. Let's write age over here. Now, as we age with time, right, degeneration of nephrons happens, degeneration of glomerulus happens. If the glomerulus gets degenerated, the effective filtration surface area will reduce and the GFR will reduce. So, along with age, the GFR reduces, right? So more we age, less will be the GFR, right? So let's sum it up. What are the conditions which affect the GFR, right? In exercise, the GFR reduces because of sympathetic stimulation. In pregnancy, the GFR increases because of the volume overload, and also because of the vasodilatory effect of progesterone, right? In weather, in rainy season, the GFR is going to increase. In dry season, the GFR is going to decrease, right? In posture, because we stand, the blood will pool. It will lead to reduction in the effective circulating blood volume, right? This will reduce the GFR. And also, sympathetic stimulation will reduce the GFR, right? Posture, right? Apart from that, sleep, we will have two opposing effects, right, which will cancel each other out, and not much effect in GFR, right? Apart from that, gender, in females we have got less GFR because of less effective filtration surface area, and in age, more you age with time, because of the degeneration of nephrons and glomeruli, the GFR is going to reduce. So hopefully this video helped you in understanding all the conditions which can affect your GFR, right? Wish you all the very best. Thank you so much.